Hello and Namaste. My name is Smita. I am the project director of Chetna, Center for Health, Education, Training and Nutrition Awareness, which anchored and initiated the White Ribbon Alliance Rajasthan and is contributing to its activities since 2002. I am the state coordinator of White Ribbon Alliance Rajasthan and have been coordinating its activities since its inception. I also coordinate the activities of the What Women Want campaign, Midwives Voices, Midwives Demands. Now, how did we go about this campaign? So, this campaign is a result of a lot of efforts. A lot of people contributed to this campaign. But I would like to start from women. I think first and foremost, we should acknowledge that women who participated in the What Women Want campaign were the key initiators of this campaign. It is because they demanded services by women, services at the doorstep. This formed the basis of the campaign What Women Want, Midwives Voices, Midwives Demand. Secondly, the midwives or the nurses who participated in this campaign need to be acknowledged because it is their voice and their demands which is leading to a meaningful campaign at the global level. So I would like to acknowledge them. And of course, the Department of Medical, Health and Family Welfare, the district and block level officials who allowed us to meet the midwives, meet the nurses and take their demands. Last but not least, the White Ribbon Alliance members who facilitated the data collection and participated in the survey deserve a special mention. We had 11 partners and I would like to acknowledge them personally. They are Shrishti Seva Samiti from Udaipur, Navachar Sansthan from Chittorgarh, Jatan from Rajsamand, CRPR from Tonk, Prayas from Jaipur, Shiv Siksha Samiti from Tonk, GUSS from Badmer, Gravis from Jodhpur and Neera from Karauli and SRKPS from Junjunu. Chetna team, the Nandgarh team who contributed in the survey from Badmer and Jalore districts. So it was a multi-people effort which led to such a great data. We collected information from 2,500 midwives across 11 districts of Rajasthan. Now, how did we go about it and how did we explain is another question. So when we went, first we had to go to the officials to seek their permission and explain it to them. So we took all the resource package that was provided to us by White Ribbon Alliance and had discussions with the block officials to explain that this is a global survey and we need to meet the nurses and staff nurses and collect their demands. They were not convinced at first because it was like, why do you need that? Whether you will be able to fulfill the gap, how will a local gap lead to fulfillment when you are just going to a global level. So there were a lot of questions which we explained patiently and finally they said yes, go ahead. So after that we collected lists of midwives and then went ahead. When we went to midwives and health workers, we used the experiences of What Women Want campaign. We talked to them. We shared about the What Women Want campaign and how it has led to program and policy changes at several levels across nations. We explained that women from their area want services from a woman doctor or a nurse. They also want services nearer to their homes. And since midwives are the only person who are very near to their homes, it's very important that their demands are fulfilled. Then they can serve women better. So this is how we helped them to understand the importance. But still, they were not very convinced about how would their demand, sending it at the global level, impact decisions. And for that, we had to do a lot of convincing and explaining that a collective demand always will have an impact and their demand would feed into a larger advocacy event which would impact midwives worldwide. So this is how we were able to discuss with midwives and staff nurses and officials and to the partners also. When we went to the midwives, the team trained surveyors from the local area went and met the midwives. The survey was both physical and virtual also. So people had to go because midwives don't have connectivities, and there were issues regarding using their mobile phones during their work hours. So the best was go and meet them personally. So a lot of midwives were contacted personally, and when we went and talked to them, initially they were skeptical, they were scared and resistant. They were skeptical, as I said earlier, how would their demand at the global level lead to some change, and why would they want to participate in such an event. They were also scared of backlash. They were also scared whether this would lead to going against the government and losing their jobs. They also were not very sure about whether their own needs would be fulfilled or not. So a lot of discussion, a lot of convincing happened, and then finally for the larger good, they agreed to participate and submit their demands. For the surveyors, what we did was we talked to our partners, White Ribbon Alliance partners, and gave a call. And people who were interested did agree that okay, we would participate in this campaign. Once we got their agreement, we had a virtual meeting where the entire process was explained to them. And after that, they identified local surveyors or data collectors. These surveyors or data collectors had experience of working in the field for at least 5 to 10 years. And they were good at doing online surveys. We had done another online survey, app-based survey for White Ribbon Alliance. So they were used to such surveys. So these surveyors were then trained by both virtually as well as physically. Where it was possible, we collected in small groups and did physical training, and where it was not possible, we had virtual trainings. So this is how the surveyors were trained to collect data. First step was convincing, mobilizing, explaining the larger good, and then asking the midwives to submit their demands. After the explanation, we did some practice sessions where they had to go to a mock facility, talk to a midwife and encourage them to submit their demands. So this is how we trained the surveyors and data collectors, and they collected demands. We were able to collect the demands in a period of 2 to 3 months. Each partner, according to their local area, submitted the number of demands they would collect, and overall we were able to collect 2,500 bonds. We have experience of talking to local government officials. As I said earlier, it was a mixed reaction, but we did a lot of convincing. We have not yet interacted with state or national level government, so it's difficult to say how they will react. But given the experiences of so many years, I think the reactions could be mixed. Some may be really happy and they would see this as an opportunity for action. So we expect a mixed reaction. We have not looked at the entire data, but looking at the data submitted from Rajasthan, mostly they asked for more human resource, especially because of COVID immunization work, their workload has increased. They have asked for better task planning, job rotation and roster, and they have asked for basic adequate supplies, instruments and infrastructure so that they are able to perform their duties well. I was not surprised because we would expect such demands from nurse midwives, so there was not a big element of surprise. It was expected that many would not have this basic things. The unexpected things, if you ask me, I think we were not very sure. Given the COVID, given the fact that we decided to collect major demands from public health system, we were not sure that we would meet the target of reaching out to 2,500 women. So this was very unexpected, and we were able to meet that demand. The most positive thing about the What Women Want campaign, Midwives Voices, Midwives Demand, is that we are able to bring out the voices of unheard. But here is an opportunity where we are listening to nurses who have hardly been asked what are their needs and what are their requirements. So I think that is the most positive thing about this campaign. And I think the challenge would be to meet the demand at the local level. Somehow, despite a lot of convincing, we have raised expectation. But then if they don't get it, they will be frustrated. So that is the most important challenge I see in this campaign. And if you ask me what should we do, I think we should start talking. The advocacy is very important, and I feel that it should be at all levels. We need to advocate at the local level so that local action takes place, and also at the national and global level. This is a very important campaign, and we hope that through this campaign, women will be able to get what they want. Thank you.